and today we are talking about PCOS, acne, weight gain, facial hair loss, irregular periods, fertility issues. If any of this describes you or someone that you may be dealing with something called PCOS, polycystic ovarian syndrome. And even though the name sounds like it has to do with cysts and ovaries, it doesn't really. I'm going to explain that to you. And women come into my office every day who are given this diagnosis and they're just given medication and they're not really advised on how to fix it. So this is why this podcast is super important, because so many women get this diagnosis. 1 in 10 women are affected by it and are not being told that there's actually something that they can do to fix it instead of just medicating for it. And for some of you, you might think this episode doesn't really apply to you because you don't have PCOS, but it actually applies to everyone. Because what we're talking about here is a serious hormonal imbalance that causes havoc in your body. And once you understand the cause, you'll understand that it can affect you even if you don't have PCOS. So let's do this. As always, I like to tell you how to reach me and my team. And so do I have this here? I don't have it here, and that's okay. So wherever you are, make sure that you click and like. Wow, I messed up everything because I don't have it in front of me. So here we go. It's the new method everywhere. If you're watching us on YouTube, don't forget to like and subscribe because why not? It's free. You can follow us on Facebook, follow us on Instagram. We are super funny. Wherever you are, you could just private message us. And if you private message us, we will answer. We actually have people answering it. And don't forget to share this with the game changers that you love. And if you're watching us live right now on Facebook, let us know. Ask a question. Even if it's not about PCOS, we're down for it. And if you're watching us on replay, let us know. Type in the word replay. Let us know that you're here because we will answer you. So now that I fixed it after I messed it up, let's jump into PCOS, polycystic ovarian syndrome. And like I said, pay attention even if you don't have this, because you're going to be amazed at how this affects just about everyone. So PCOS, polycystic ovarian syndrome, affects between 5 to 10% of all women. And it's actually not one thing. It's a spectrum of things, which is why I want everyone to pay attention, because it's not one thing. It's a spectrum. And you can have just one of these symptoms or all of them. PCOS includes irregular or heavy periods, acne, facial hair, darkening of the skin around the neck. People try to scrub it off and it doesn't come off. You might have hair loss, increased belly fat, or increased levels of testosterone. And if you're dealing with any of these things, you may have PCOS. You don't need to have all of them. And for some women, they don't discover it until they're trying to have children and they find out they're having fertility issues. And conventional medicine usually views PCOS as a GYN problem, as a gynecological issue. Because, the word ovaries is in it, so it must be a GYN issue, right? But it actually isn't a GYN issue. And this is the key. It's a systemic issue. Your whole system is involved, because even though we like to separate things into separate offices, the GYN's in one office and the stomach person is in the other office, it turns out things are interconnected. And when you understand that, or until you understand that, you actually won't be able to fix it. And that is why I decided to dedicate this week to this topic. Because like I said earlier, so many women come and say, hi, I was diagnosed with PCOS and now I'm on these medications. And they're taught to treat it like a disease that requires medication. And they're never told that there's actually a way out of it. And what they're getting is just medication to manage symptoms. Right? Here's some spironolactone for your excess facial hair. Here's medication for your acne. Here's some metformin to help lower your testosterone levels and hopefully you'll ovulate more. Or here's birth control pills to regulate your periods. But there's no question, there's no conversation of why. Why is this happening to me? So they come to my office devastated. They just got this really scary sounding diagnosis and maybe a pill or two, and they're never ever told that there is a cause and possibly a cure. And once I walk you through it, you'll see how it can affect so many people. So how is it diagnosed? It's often diagnosed with blood work and sometimes an ultrasound. An ultrasound to see how your ovaries and uterus are doing. And remember, they can be normal, so it doesn't have to be abnormal. And a blood test to see if your testosterone is high. And then these women are told, hey, your testosterone is high. Your ultrasound showed us maybe some things. Here's some meds. And like I said, they're not taught why it's happening. And women with PCOS struggle. And again, just like there's a spectrum of symptoms, there's a spectrum of struggle. Some people just have the physical symptoms like weight gain that they're struggling with, or hair growth and acne. So they go for cosmetic treatments, electrolysis, laser hair removal, and they try to manage the symptoms, but again, not managing the cause. And then for some people, the issue is bigger than just cosmetic because they can now more susceptible to serious health problems, type 2 diabetes, high blood pressure, heart and blood vessel issues, uterine cancer. And as I mentioned earlier, some women with PCOS have difficulty getting pregnant. So just like there's a range of symptoms, there's a range of how much it affects people's lives. And here is the bottom line. Even though we're talking about women and sex hormones and periods and testosterone and having babies, the cause of PCOS has nothing to do with sex hormones. It's actually not a GYN issue. The issue with PCOS for most women, and I'll get to the exceptions also, but for most women, it's actually an insulin problem. Okay. And if you've watched any of my shows, you know that's always the case. People with psoriasis, it's not a skin problem, it's a system problem. People with, reactive arthritis, it's not a joint problem, it's a system problem. And people with PCOS, it's not a GYN problem, it's a system problem that's expressed in the GYN world. So let's explain what that means in PCOS. So it all starts with insulin. Insulin, for those of you who don't know, it's that hormone that helps us balance our blood sugar, right? So here's how it works. You eat a meal, that meal is transformed into glucose. And now the glucose has to get into the cell. So insulin, I want you to think of insulin like Uber. Uber picks up the glucose and brings it over to the cell. Okay, that's how it works. When everything works well and the Ubers work well, everything is fine. The cell says, thank you so much. I really needed this glucose. Amazing. But now we eat another meal or another snack, and the insulin picks it up, has this glucose, and it has nowhere to drop it off. Okay, the cell doesn't want it. This conversation, it doesn't know what to do with it. So it doesn't know what to do. So now it's walking around with all this extra glucose, and there's glucose everywhere. So the first thing the body does is says, oh, we must need more insulin. So it starts releasing more insulin. This is what's called hyperinsulinemia. So you have more insulin in there because the body's thinking, okay, if I could just pick up more of this glucose, it should be fine. But where do I put it? Where do I put all these passengers? The cells don't want them. So this conflict between insulin and the cells is what we call insulin resistance. You can have all the insulin in the world, but if the body doesn't need all that glucose, then they don't know where to put it. That's insulin resistance. So these Ubers don't want to drop off the glucose. If they drop the glucose off into the blood, that's diabetes. We don't want that. So it's going to start putting it in places. It starts putting it in the belly. That's why we gain weight in the belly, especially it creates fat around the organs. It also increases cholesterol. It increases triglycerides. So now this is what insulin is about. Insulin resistance is about, right? So we have this issue. Now you're beginning to understand why we have the weight gain. But the other thing that insulin does is that insulin for women will tell your ovaries to produce more testosterone. Now, all women have testosterone. We need testosterone. We need to have a certain range of testosterone. But too much testosterone causes an imbalance. And that causes some of the symptoms that we see. The facial hair, hair in areas that we don't want, the acne, the hair thinning, and the period disturbance. And for those of you who are trying to get pregnant, the testosterone also messes with the hormones that produce eggs and ovulation. So instead of having these fully developed eggs for women with PCOS, the testosterone messes up how they make the eggs. And so instead of becoming these mature eggs, they become small cysts. And that's why, and then they have a collection of these. That's where the name polycystic ovarian syndrome comes in. But you don't have to have those cysts to have PCOS because the issue is insulin and testosterone. So the problem isn't that your body's producing these ovarian cysts from nowhere. The problem is happening upstream with the increased testosterone, which is all happening even further upstream, too much insulin. So you're starting to see why the answer isn't about fixing your sex hormones. The answer isn't to give you birth control or to give you a medication to stop facial hair growth. And I'm not telling you not to take it, but I'm just saying it's not the answer. The answer is about insulin. This, by the way, is why so many women who have PCOS get a medication called metformin. Metformin is not a PCOS medication. Metformin is a diabetes medication because the person who prescribed to you understands that PCOS is an insulin issue, but maybe they never explained it to you. So you're walking around thinking, oh, I have metformin. It's a PCOS medication. It isn't. It's a diabetes medication. I want you all to start thinking of PCOS like a pre-diabetes. If you have PCOS, you have an insulin problem. So if I told you today that you have diabetes and here's some meds, you would probably say to me, wait a minute. Before you give me these meds, let me change what I eat. Let me try to exercise. Let me see if I could do some lifestyle modification before you give me these meds, because you know that there are things that you can do to reverse the diabetes. And that's the same way I want you to start thinking of PCOS. Now, to be fair, there are some women who have PCOS without insulin resistance. There are some other hormonal imbalances. And at the root of that is inflammation. But stick around because I'm going to talk about that as well. But for most of you, PCOS, it's an insulin problem. And if you want to get to the core of what's going on with you, you need to get to the core of how to control your insulin. So your treatment is not about medication. It's about teaching your body to become insulin sensitive, right? For those cells to accept the insulin and to stop the overproduction of insulin. So what are the tools that we can use? Number one, intermittent fasting. And I did a whole episode on that. Please feel free to check it out. So I don't want to take too long. But we are at the new method. We really promote timed eating. It's called the 16-8 method. That means you're eating for 8 hours and fasting for 16 hours. And for any of you who are listening who don't know what that's about, don't panic, because that 16 hours includes your sleep. So it's like you eat till 7 and then you go to sleep and then you wake up the next day and you eat at 11. So that's what 16-8 is. And like I said, I did several TikToks and I did a whole episode on it, so you could check it out. But the idea behind intermittent fasting is that when you're fasting, your insulin levels calm down and you start to become insulin sensitive, and downstream that normalizes your hormones. Of course, the other tool to use to become insulin sensitive is a low carb diet. And you know what I mean when I say low carb, so don't come at me and say broccoli is a carb. I know broccoli is a carb, but that's not the problem, right? No one out here is overdosing on broccoli, okay? You know I'm talking about the starchy, sugary things, but there's always someone who comments, don't say no carbs because broccoli is a carb. I know, I'm not talking about broccoli, okay? Thank you. So I'm talking about the starchy, sugary things, the delicious things, the donuts, the french fries. You know, when you eat them, your insulin spikes up. When you eat broccoli, it doesn't spike up. Eat the green stuff and the purple stuff and the red stuff. Eat the rainbow. These are all the things that make you insulin sensitive. Now, if you're listening to this and all this hits home and you're like, yeah, I really could clean up my diet a little bit. Great. Start doing the work. And of course, if you need guidance, you can reach out to me and my team. We can work with you. But once you start implementing these things, not only will you see weight loss, but the symptoms of PCOS improves. Your appearance is going to get better. Your acne will get better. The facial hair will get better. The periods will improve. You will overall just feel more amazing. Now, there's going to be some of you out here, and it's really important that I talk to you guys as well. There are some of you listeners who say, listen, I have PCOS and I don't fit your profile. I'm not struggling with weight. I don't eat junk food. And I still have PCOS. And I alluded to this segment of the PCOS population. And for you, PCOS is still a hormonal imbalance. And it might not be an insulin issue, but there are other pathways that create this hormonal imbalance. But the solution still lies in nutrition and in special functional medicine testing, and for many of you. And I'm going to give you 2 case studies so you can see what I mean, that even though if you're not one of the people who have an insulin issue, you're going to see how nutrition is still going to get you there. Because you're going to have 10 women with PCOS, and each one of them may have a different trigger. But ultimately, no matter what the trigger is, they have elevated testosterone and other hormonal imbalances. And the goal is to find out why. Why is the hormonal cascade happening? Why are my periods irregular? Okay, not just to medicate. So let's talk about a little bit, for those of you who have PCOS who are not related to insulin, there is PCOS that's linked to different endocrine disruptors, different hormonal disruptors, chemicals, environment, inflammation, all of which needs to be addressed to find the root cause, the why. It's all about the why. So for one person, you might need to focus specifically on insulin resistance, and for another person, you might need to look at gut microbiome. But for both women, it's about finding the root cause, okay? I don't want you to just accept it. And the beautiful thing about functional medicine is that you really have to get to know the patient's history before you start treatment, because it is customized. It's not a one-size-fits-all. So let me give you two different examples of women, both with PCOS, but each one needs a different treatment, and you're going to understand what I mean. So let's first start with a more typical patient with PCOS, a 30-year-old female. This is actually someone I work with. She's trying to get pregnant, and she states that over the past few years, she's gained some weight. She's about 15 pounds overweight now. Her periods are irregular. She complains of hair in her cheeks. She had it lasered, and she's seeing dermatology for her acne. And she said she's always had period issues and was on birth control for a few years. She got off the pills 3 years ago, and her periods never normalized. But now she wants to get pregnant, and she can't. And she thinks it's because she was on the pill for so many years. But it's actually not because of the pill. It's because the original issue was never addressed. The issue of why her hormones were off to begin with, why she needed the pill in the first place. So she came to me because her endocrinologist, God bless them, had the presence of mind to say, you should go see E. She'll help you out. So her hormones were all over the place. And most importantly, for her, in this case, she was insulin resistant. Insulin was high. She wasn't a terrible eater, but also not the greatest eater. And I want that to resonate, because most of you out there are not, eating everything in the world, but you may not be exactly on point when it comes to insulin resistance. So she started the day with oatmeal or a bagel, had a sandwich for lunch, pasta or rice with veggies for dinner. Every now and again, she had a glass of wine. Nothing crazy. And this is important because many of you don't realize how many carbs you consume, because it's normal to eat a bagel or a muffin and then a sandwich and a pizza and a pasta and a rice. And it's so normalized that you don't even realize how many carbs you're eating. And this is a lot of carbs, even though it feels normal, especially if you're in this situation. So with this case study, it's clear that the nutrition is where we had to start, specifically low carb. So we lowered her refined carb intake. We had her start intermittent fasting. We got her moving, put her on some supplements. She lost the extra 15 pounds, but more importantly, her periods regulated, and she got pregnant within 6 months of starting. So in this case, by fixing her insulin with nutrition, her hormones became balanced, and she was able to get pregnant. But then there's another woman. This is the other case study, and I'm saying this because some of you out there listening are going to really resonate here. There's another one we treated with PCOS who had a completely different treatment. Same disease, different treatment. She did not have any excess weight, and she still had the irregular periods and the acne that she was trying to manage. In her history, she told us a lot about her GI issues, and she's lactose intolerant, and she had frequent UTIs that required a lot of antibiotics. So this is a person where we're thinking less about carbs and more about her gut microbiome. Now, if you don't know what that is, make sure you check out one of my episodes and 5,000 TikToks. I talk about gut microbiome like all day, every day. But here's a quick recap, okay? It's just basically there's an entire world living in your belly full of bacteria and viruses. Deal with it, because it is really the most important part of your body. You need it to stay alive. And so with this patient, we knew it was a microbiome issue. She's on antibiotics for so long. She's lactose intolerant. Her belly hurts all the time. So with this patient, we went a different way. We did a stool test to see what's going on with the bacteria in her belly. And we discovered there was an imbalance. And we fixed that imbalance. And in her case, that imbalance created a hormonal cascade. So we still cleaned up her nutrition. But instead of focusing on insulin resistance, we focused on finding the triggers and introducing high quality, diverse foods, gave her probiotics. And again, over time, periods normalized, her face cleared up, etc. Two different women with PCOS with hormonal imbalances, two different causes, both solved with nutrition and supplements, because we're looking for the why. Now, as always, I am not telling you not to take your medications. Please, I would never tell you to do that. I'm just telling you to ask the questions and find the root cause of your PCOS and any chronic issue you have, not just PCOS. Always find the why. Address the issue. Don't just accept it. Now, everyone always wants to talk about supplements, so let's talk about supplements. Of course, I want everyone on a multivitamin, good quality probiotic, and omega. But for PCOS that is insulin resistant, there's another supplement called inositol. And inositol really helps the cells become better to responding to insulin, right? We have that insulin resistant problem. This supplement helps insulin resistant. So it helps the body manage and balance the sugar levels. Of course, has to go together with nutrition. Don't take inositol and eat a gallon of ice cream and think it's going to work out, because it won't. And so that's for our insulin resistant case. And for everyone else with PCOS, of course, vitamin D, because it helps hormonal imbalances. And of course, omega-3, because it is super anti-inflammatory. So the bottom line is, for a recap, if you know you have PCOS, or if you have the symptoms of PCOS, of course, get checked out, do the blood work, do the ultrasound. And if you're given meds, I'm not telling you not to take them, but what I'm saying is find a guide to help you find the root cause of why you got here in the first place and solve that issue instead of masking it with meds that make you feel and look better, but don't solve the problem. And of course, if you want to work with me and my team, you just look for the New Method everywhere. New is spelled with a K, because you always knew there was a better way. We're on Instagram, we're on Facebook, we're on YouTube, we're on Threads. We're everywhere except for Twitter, X, whatever it's called. Wherever you are, find us so we can help you become the game changer in your life. I hope this helps. I'll talk to you guys soon.